I'd like to say welcome, Sandeep. Thank you so much for joining with me in this conversation. And today we're going to be talking about polyvagal theory and the importance of this theory to do with health and wellness. As you have been working on your internship, and this is an area of interest that you've done a lot of research on and put together a workshop on. So first off, I'd like to say not only welcome, but I'd like you to just introduce yourself to everyone. What brings you to us today?
Yeah, thank you, Dr. Laurie, for welcoming me and for giving opportunity to introduce myself. And it's a great opportunity to discuss about the polyvagal theory with you today. Yeah. So, my name is Sandeep Bains. I'm a registered nurse from last 17 years almost. Yeah, I work in the hospital. My area of expertise in the operating room, and why I come to this profession, because in the hospital I saw mostly in the COVID, all the healthcare professionals, they are suffering from anxiety, stress, and even the patients, they are going through so many mental health issues. So that time, I think like that, like I'm working with the body, like in the hospital. Now I have to work with the minds, the people, they need, I can say all around care, not only the physical care, they have to be, we have to focus on their mental health too, because the way we have to focus on the mental health is going to be cover other areas of their health issues too. Yeah.
Yes, very good, very good. And you're going to be working with us at the Counselling House going forward, incorporating polyvagal theory as well as many other different theories and modalities together in order to be able to bring to clientele that mind-body relationship wellness. And part of that is actually participating in our retreat program, which has the opportunity to provide inpatient as well as outpatient for our clients as well, to do with any kind of addictive obsession, whether that's to do with drugs or alcohol or food or exercise or you name it, anything can be an addictive obsession. Yeah, and once it is that brain is triggered, right, and that repetitive behavior becomes ingrained, then it can be very, very difficult to start to grab a hold of that to transition in. And so, walk us through the polyvagal theory and its significance. Tell us about it. What is it?
Yeah. So first of all, Dr. Laurie, thank you so much, for suggesting me to do my research on this polyvagal theory. You can believe, like, as a nurse, I know about the vagus nerve, but I never know like that how this theory is going to be help us to control our autonomic nervous system, so that how we are going to be interact with the social situations, And I'm so grateful. I really did the research on that. I made my presentation on that, and I think this is a great workshop for the people. It's going to be helpful for them to control their autonomic nervous system in their physical or in their mental health issues. Yeah.
Mm-hmm. And by autonomic nervous system, you're talking about automatic, right?
Yeah. Yeah.
Yes.
So I would like to explain more, like from where this theories come, how it's going to be, what are the main focus of this theory. So I'm trying to be have to be discuss more on that, So this theory is a work of Dr. Stephen Porges, and it's a scientific way of understanding our changing nervous system from reptiles to mammals, The main focus of this theory is to control our autonomic nervous system, which control our responses to stress and danger. So according to the theoretical concept, it is very important, because all human beings did evolve at different reactions to the different social situations. Yeah. So I think, if we are going to understand this theory, like what it is, like why it is important, and if we are how we are going to apply in our daily life to control our stress, anxiety, overwhelmed, and I think other psychological situations. Yeah.
Mm-hmm. And this is something that affects everyone, right? All ages.
Yeah. Yeah.
And so it's important, even with parenting, to incorporate this while it is that you're actually, dealing with, talking to, figuring out situations with your children.
Yes. Yeah.
As well as, well, adult parents.
True.
And
Yes.
spouses.
Yes, yes, all ages. It's really important. Not only the adults, like even in the schools, the teenagers, they have a very stressful situations. It's going to be helpful to control their behaviors, like in the aggressive situations. But I think the people need a more awareness about that polyvagal theory, because this is the new theory in the neuroscience and in the psychology. But this theory is gaining a popularity, because of its, the great, potential for managing the physical and the psychological health issues. Yeah.
Mm-hmm. So tell us about the vagus nerve. How does it work?
Yeah. Because I'm going to give an example here. I have a 30-year-old patient who came to me with a sleep anxiety. And I'm working with my client from last, like a 3 months, we try each and everything, even the things are working, but not the way the client wanted. We work on the CBT, the cognitive behavior therapy, we try mindfulness, and then I discuss all this thing with my supervisor, with Dr. Laurie, and then she suggested me to have to work on the vagus nerve, and that's what I was thinking, man, how is going to be happen, and
Hmm.
then I realized, we always tell our patient, hey, you have to do a deep breathing exercises, and the main reason why we are asking the clients and the patient to the deep breathing, because we have to be activate our vagal nerve. Or once the vagal nerve is going to be activated by doing the deep breathing exercises, it's going to be helpful. It's going to be really helpful for us to be control our anxiety, stress, and I think any other situations that really bothers us. Because with this theory has a power, to control our autonomic nervous system by regulating, by shutting off, because we have it's in our hands. If we know the steps, if we are aware how we are going to be in for example, if the stress is coming, and the stress kicks our sympathetic nervous system, and the different reactions is going to become to that social interaction. Maybe the client feel anxious, maybe the anxiety is going to become, and that's why we have to be, this theory is helpful to understand our feelings and how we are going to be regulate our autonomic nervous system in that situation, and how we are going to be shut off that situation to keep ourselves safe from those situations. Yeah.
Ah, I see, I see. Exactly. So it's important to be able to understand yourself, how it is that you react, and then to be able to engage your own calming to calm that vagus nerve.
Yes. Yeah.
Mm-hmm. Yeah. So, I mean, there's like a kind of like an image that comes to mind, right? As sort of as a ladder,
Mm-hmm.
right? Like when we're up here and we're able to think and process, right? That is our safe and social place where we're engaging, we have good eye contact, that we're in a good place,
Mm,
right?
yeah,
Mhm.
yeah. That's a great example. If you're going to be see like a ladder, the step by step, the things are happening, and we can control the way they go just in front of us. Yeah.
Mm-hmm. And then when stress sets in, right? And then we actually really start to lower. We're no longer up here. We're no longer able to think things through, process, keep
Mhm.
our eye contact,
Yeah.
smile, right? We start to go down, and then we actually really start to engage that fight, flight, or freeze,
Yeah.
right?
Yes, yes, that's a great point, Dr. Laurie, because yeah, it helps us to be, the sympathetic nervous system is when it's going to be kick off, it's give a reaction, hey, fight or flight mode, So it's all the, the work of our nervous system, and we have to be understand this theory, how it's going to be helpful for our daily life, to manage all the things that is not in our hands. Yeah.
Exactly, exactly. So not only is it important to be able to know it with yourself so that you know exactly where it is that you are in your own processing in your own body, but also when it is that you're engaging socially with others to be able to really pay attention to that because you need to have whoever it is that you're talking to with you here, right?
Yes, yes, yeah. Because yeah, it's really helpful to understand your own emotions, how you're going to be interact. Because sometimes we don't know the things that just happen in front of us, and we start taking stress, and we don't
Mhm.
know how we have to be respond to those emotions, And some people they don't know what's the work of this polyvagal theory. It's really grateful to because you can use this theory once you are come for your counseling, come for your therapy, and your therapist is going to help you to control this, and even you can try by yourself too if you understand how it's going to work and how it's going to be. It's not kind of treatment, it's just a plan, the way you just tell the examples, the ladder. You are the boss of your own body, you know where it's happening and how you're going to be control it. Yeah.
Exactly, exactly. And then not only to be able to know exactly where it is that you are, but to be able to gauge where another person is and use those same techniques in essence, really, to bring the person back up into being safe and social.
Yeah.
Because if you're not dealing with someone who is up here, because
Mm,
safety is everything, then
yeah.
they're not engaged, right? They're
Yes.
not able to process, they're not listening to you, right? They're in that place of fight, flight, or freeze. They're either going to become angry, push away,
Mhm,
or run away, right?
mhm.
And then start to shut down,
Yeah.
right? And that's that last engagement, right? That place where it is that the person, in essence, faints,
Yeah. Yes.
right?
Yeah. That's a great point, Dr. Laurie. If they're going to be take over stress, of course, and that time our nervous system is going to be shut off. It's going to be freeze, and then it's going to be a factor on our body. The heart rate is going to be up. Respiratory rate is going to be a factor. It's going to be go up. Digestive system. It's going to be a factor of our emotions, our mood. So I think it's all is happening because of our nervous system. It's a head. The nervous system is here, and it's also a component of the peripheral nervous system because it has a great role to manage our emotions, our feelings, and to control the physical symptoms of stress or any other issues. Yeah.
Mm-hmm. And I mean, that's the one thing that really comes to mind as it is that you're talking, especially when it is that people go to visit their doctor and they're waiting for some significant or important news, right? And so it is a safety mechanism that starts to engage when it is that it is very scary, perhaps the information that's coming to them to really go down that ladder, right? To, in essence, remove themselves from this scary experience, no longer listening, no longer able to understand the information being given, that sort of thing. That's why they always say, bring someone with you so that they are engaged and able to ask questions,
Mhm.
write down the information, that sort of thing.
Yes. Yeah. That's a great point. Yes. Yeah. Yeah.
And that's because this is what it
Mhm.
is that's happening, right?
Yeah.
It's a normal process that everyone experiences.
Yes, yes, and yeah, because all we all in our daily life we all experience stress, anxiety because of the workload and other issues, So no one is alone, But this is our body, And every human have a different interactions, And the different reaction with the different situations. So I think this is really important to do the awareness, So that we can aware people about this polyvagal theory and how it's going to be helpful for them to manage their physiological and mental health issues. Yeah.
Exactly. That's really a great point. And I think, especially in the work that you're wanting to do to engage with people with their addictive obsessions, whether it's to do with eating or doing too much of anything or not enough of something, right? As to exactly where it is that they are and how to get themselves back so they're actually really not lost in themselves,
Yes.
and so that they can actually really know exactly what it is that they're doing and be able to follow their own plan or their own health plan.
Yeah, yes. So I
Mm.
think also they have to be remembered, the deeper we are going to be understand ourselves, as you already discussed earlier when we just start this session, the deeper we are going to be understand our body, the more we are lead to fulfilling, and we are going to be connect to the life. I want to be say, the more we are going to work on our body, the more we are going to be understand our body, the more we are going to understand our emotion, the more we are going to be connected in our daily life. Yeah.
Exactly, exactly. Yeah. So I think that's fantastic, right? Because it's an element that is very, very important of information so that people know exactly what it is that they're dealing
Yeah.
with within themselves and why it is that they do what it is that they do,
Yes.
right? It's a safety mechanism, really. And people engage that. It's a coping, a way to cope with whatever that scary situation might be or
Yeah.
upsetting situation might be, right?
Yeah.
And yeah, and so to be
Yes.
able to then understand that, know exactly what's happening within you or within somebody else that you're engaging with, in order to know when to step forward, when to step back, right?
Mm-hmm.
Mm-hmm.
And also, Dr. Laurie, like in one of my, when I'm doing my research, I just try to find out that, that it's really helpful for in trauma situations too. A person they already experience a trauma, or they can avoid the traumatic situations, if they know more about this theory. Yeah.
Wonderful. Yeah. Well, I think that this is great information. I think that this is going to be really, really helpful to people, especially when it is that they're dealing with any kind of addictive obsession, whether they're doing too much or too little, right? So that they know exactly themselves. But fantastic as well, too, because with anything like that also comes along conflict.
Yeah.
Conflict with family, conflict with society, right? Conflict with the healthcare profession. I mean,
Yeah. Yeah.
lots
Yeah.
of conflict, right?
Yeah.
And so, yeah, and with conflict comes the need to protect, for sure, right?
Yeah.
So how to remain engaged, how to, in essence, get what it is that you're wanting, be in a healthy place, and know when it is that you're not is really important.
Yeah, yeah. And also, Dr. Laurie, I'm just going to add one point here. We just try touch base a few points of this polyvagal theory. And even if somebody want a more explanation, more want to be learn more about that, we already have a presentation on that too, and anyone can make their appointments with us, if they going through any kind of issues, stress, anxiety, and they want to be know more about that, they want to try the polyvagal theory, they are most welcome. They can call anytime at the counseling house, and we can take from there. Yeah.
Exactly, exactly. That's fantastic. Well, thank you, Sandeep, for joining with us, giving us a little bit of insight into how it is that this theory is actually really helpful for people. And it's a theory, not particularly a modality. It's not exactly the same as like CBT or ACT or anything like that. But it's actually really more to do with your physiology, right? How it is that you work as an individual and how that actually really comes into play, right? Because as humans, we have a long, long, long history with how it is that our brain has developed, and it's developed in a certain way, right? From our animal instincts and that automatic response in order to keep ourselves safe to our mammalian way of being, where it is that we have, the brain in order to be able to think things through.
Yeah, yeah, yes, yeah. And
Hmm.
thank you, Dr. Laurie, for giving opportunity and giving a time to talk on that theory. And I think it's a great job if you're going to be help the people, with this great theoretical concept of polyvagal theory. Yeah.
Yes, wonderful, wonderful. Yes, well, I'd like to, welcome you to the Counseling House, welcome you to the Portside Art Institute, where it is that we're going to be doing an outpatient and inpatient program, and so that you're going to be our, mental health practitioner and helping people along the way.
Yeah. Hey, I'm ready, Dr. Laurie. Yeah, I'm so blessed because I finished my practicum under your supervision, and I think it's a great opportunity to learn a lot of things from you and from my clinical experience. And I'm so glad, to be the part of Counseling House. Thank you so much, Dr. Laurie, for everything. Yeah.
Well, thank you, Sandeep, for your research and your presentation. And if anybody would like to engage with it, all you have to do is email us and let us know. And yeah, there's some great learning.
Yeah, it's a great start for the polyvagal theory too. Yeah, thank you. Yeah.
Thank you. Thank you, Sandeep.